Hi, I'm Kelsey Uchi, and I'm here to talk to you about why we should all know about glutamate and how it will change drugs and therapy. First, to understand the direction we're headed in, we need to reflect on the current issues we're attempting to address. While stigma against mental health conditions persists, we are rapidly trending towards acceptance and seeking treatment earlier on. My hope is that we'll get to preventative mental health, just as general healthcare is striving for. However, therapy remains confusing to the average consumer. Research generally points to cognitive behavioral therapy and interpersonal therapy as frontrunners in the treatment of depression, exposure therapies for PTSD and OCD, but what does that even mean? Even more disheartening are the typical experiences of trying to find the right medication. We can't stick a syringe in anyone's brain to accurately discern what kind of biochemicals might be imbalanced and what corresponding medications will be appropriate. Without a degree in this stuff, how is anyone supposed to know how to access the effective care they need and deserve, let alone while they're struggling with mental health barriers that make it hard to get anything done to begin with? Enter the glutamate hypothesis of depression. Here's glutamate, the queen of all neurotransmitters, ruling all other neural processes. She's responsible for nearly all excitatory signaling, from moderating vision to movement to stress responses. We used to think that monoamines were key in mood disorders, specifically that depression was caused by a subcritical level of serotonin at the synaptic cleft, but it turns out that monoamines are definitely critical, but they are still commanded by glutamate. Glutamate is a democratic ruler and produces the metabolic precursors to GABA, the inhibitory neurotransmitter. In a well-functioning brain, glutamate creates its own checks and balances. But much like governments gone awry, too much glutamate is toxic. Overexcited neurons short circuit and fizzle out, leading to dendritic atrophy. And because stress is an excitatory process, chronic stress fosters glutamate excitotoxicity, leading to thinning, shriveling dendrites, and therefore fewer synaptic connections. This is key. Fewer synaptic connections means that depression isn't necessarily caused by low serotonin at the synaptic cleft, it's caused by fewer synaptic clefts. This helps to speak to the prefrontal and limbic atrophy seen in postmortem studies of depressed brains, in addition to their normal levels of serotonin. So serotonin does moderate mood, but it needs a place to work, and glutamate excitotoxicity breaks that space down. How thrilling, you're thinking to yourself. I know, but I care because why? Because drugs, obviously. But in all seriousness, the first impact of the glutamate hypothesis is psychotropic medication. If we understand that we need to address glutamate rather than serotonin, mood disorders can be much more effectively treated. Therapy can also benefit from centering stress reduction as the primary treatment goal. Learning to regulate our own autonomic stress responses literally keeps our brains from degenerating and even nurtures neurogenesis, or the strengthening of dendritic connections. Everyone is preaching mindfulness for a reason. Mindfulness is a mental workout program that teaches regulation of stress responses. There are lots of ways to learn mindfulness. There are apps, research supports Calm and Headspace. There are classes, there are books and videos galore, and if you love real-time data like me, neurofeedback is a way to see exactly how you're training your brain. I'm ahead of myself though. Glutamate regulating neurofeedback doesn't exist yet. However, the technologies do. Magnetic resonance spectroscopy can accurately detect brain glutamate levels and uses a regular MRI machine. MRI machines have been successfully used in neurofeedback before, so new brain-computer interface programs are what need development. So in summary, glutamate rules neural processes. Chronic stress pushes her into overdrive and she becomes the kind of tyrant that damages her own country trying to protect it. The great news is that we have agency in keeping Queen Glutamate regulated. Mastering stress reduction skills is how we master control of our own bodies. You're home for the rest of your life. Thanks very much for listening. These are the references used to write my original paper.